All right, guys, welcome to the podcast. Today, I want to go over a topic that's near and dear to me because I work in healthcare. And in healthcare, I always say that there's sort of three ways into fixing and healing people. We sort of have the mental, emotional, spiritual area, the chemical, which would be foods and drugs and water, and then the physical, the structural in a sense. So surgery, exercise, chiropractic care, massage therapy, sort of a body approach to healing. And in those three areas, they're very important. And I like people to spend a little time in each one when they're feeling not so good. People can come in with back pain into my office, and it could be emotional, it could be chemical. People assume it's structural. They lifted something heavy, they sat funny, and certainly that can be part of the program, but I always want people to search each of those three areas. So today we have a guest with a very impressive resume, and there's a few things I really like about today's guest. One of them is that she's just a very caring person. She's a sensitive, caring person. She's also very intelligent, and I have had some really great conversations with her in the past. I appreciate the fact that a lot of her technology is, in my mind, very cutting edge. She's not really working in some antiquated model whatsoever. The stuff she uses and works with and the people she works with, they're not easy to fix people, and she's using technology that I think is the best stuff out there. I don't know everything about what she does, and that's one of the reasons I wanted her on the show today, because I think she can really shed some light on various areas of in the world of mental health. Because if there's anything that has a strange stigma to it, it's, someone is diagnosed with a mental health condition, as if that's strange. When you realize the majority of us have issues in that area. I remember hearing that, shyness is one of the more benign diagnosable mental health conditions. And maybe she can go over that with me today, but I just think that's kind of funny because people are just considered shy or they're bold, and that wasn't really a big deal, and it certainly isn't. But to call that the beginning, I think is kind of is comforting, because most of us have something in the mental health area that isn't exactly right. And why not work on it? Why does it have to be such a thing that people get so excited about or upset about? I think we should all take a breath and realize we all have areas in that. We have aspects in that area we can all improve upon. So first I want to read off some stats. I looked up some things to get an idea of, how is this country doing? How are we suffering? How good are we doing in the area of mental health? I know just by looking around me, from the young people that I run into to some of the older, lonely people that I run into in my practice and in my life, we're not doing too well. There's a lot of depression, anxiety, schizophrenia, bipolar disorder all over the place. And I also want to get into, the improvement in diagnosis and treatment of these areas. So I just looked up a few things. 1 in 5 Americans have a diagnosable mental health issue. So 1 in 5 of us. 46% will meet the criteria for a diagnosis in their lifetime. 23% will be diagnosed by the age of 14. 8% of Americans in the past year have a substance abuse issue. 42.5 million adults have an anxiety disorder. 3.3 million adults have a bipolar disorder. 17.3 million adults have depression. 9% of youths currently are diagnosed with severe depression. 12 million adults have PSTD. 22 vets commit suicide per day in the US. I think a lot of us have heard that 22 number, which is unbelievably sad. 9.8 million adults have suicidal thoughts. 56% of adults with mental health issues receive zero help. So more than half of the people dealing with mental health issues are not receiving any help. The ratio of people with mental health issues to available providers is 504 to 1. So today's guest is necessary. She's probably got quite a load with those kind of numbers. So welcome everybody, Lisa Prefontaine, to the show today. She has quite a list of accomplishments, and her resume is quite shiny. It carries a lot of clout. She has so many great degrees Let's just go over this real quickly. Lisa has worked at Horizon Health Services for 13 years, 5 years as a clinical director for mental health services. She has maintained a private practice since 2011 and currently is full-time consultant and trainer in addition to seeing adolescents and adults in private practice, as well as teaching as an adjunct professor at Medaille and University of Buffalo's mental health counseling graduate programs. So Lisa, welcome to the show.
Hi, thank you. I'm
How
very
you doing
happy
today?
to be here. Good,
I'm
good.
very happy to have you on the show today. I want to start off by asking you a simple question. What got you into this field? What made you want to do this with your life?
That's a great question. Even from a young age, I've always been fascinated and interested in the study of people, why we do the things that we do. And in and of that, I wanted to be a teacher at some point. I was also really into science and biology. And mental health therapy actually combines all of those things. I'm teaching clients about their brain. I'm teaching clients about how these disorders develop from a physiological standpoint. So I get to do a lot of teaching. I also get to be a scientist, right? Because I'm theorizing. Yeah, how did this person, given maybe their history, their life experiences, build behavior patterns that may or may not be working for them? How have they succumbed and how are they trying to cope with the symptoms that they have? So I get to do a combination of all those things and then ultimately help people because the more information people have, the more it helps, right? Even before we do therapy, the education that they receive and the understanding, kind of what you were saying, the mental health stigma is really around, well, why can't you just get out of it? Why can't you just act normal? Why can't you just pull up your bootstraps, right? And function like the rest of us? And so we use the science to teach people this is why it can happen. And that in and of itself helps and then leads the way to the how. How do we actually help the brain and the physical aid the healing of the emotions?
That's great. I know for me, I learned early on the questions that you actually ask yourself when certain circumstances happen are very powerful. I've seen situations where people say, okay, I'm failing in this area. How will I kind of go out quietly might be one question. And another question might be, how can I turn this around right now? And I always thought the brain was like a search engine on a computer. The question you ask, it'll search for the answer. So if you ask yourself, why me? You might come up with, I'm too short, I'm too tall, I'm not smart, I'm female, I'm male, I'm whatever. Or you can, instead of asking that sort of very disempowering question, you could ask something like, how can I make this better today? I like the question, what's the smallest thing I can do today to push me in the right direction to solve this issue or this challenge, right? Even change the words around. So I think it's great that you teach people about how the brain works, because I always tell people the thought processes and the questions you ask yourself are absolutely crucial, because you really just want to answer the great questions. You don't want to answer the miserable questions that lead you to conclusions that may be part of something you were taught by your parents, teachers, and peers that weren't so kind. Could be kind of abusive questions and conclusions, and you keep thinking, I'm not smart enough, I'm not this enough. And instead of saying, well, what can I do today to make this better? Forget the fact that you may be smart, you may not, doesn't matter. What can you do today? What's the smallest thing you can do is one question if you're out of energy. And if you have a load of energy, what's the biggest thing I can do today to make this situation get better? I try to, give that to patients when they're suffering. And, I'm obviously as a chiropractor working on, their bones and joints and nerves, but I'm also working on posture, and posture and attitude are related. So I want someone to be able to stand tall, breathe deeply, but sometimes you got to give them a reason to stand tall, today. So, and having a passion and a purpose for that is good. So I love that you're a teacher. To me, in my heart, that's what I believe I am. That's why I do these podcasts. I love to interview people, and I love to learn, and I absolutely love to open up minds to new ideas. I think that's one of the biggest things that made me want to be a chiropractor. At the time I was doing it, and even to this day, it's still new and it's still growing, and it's an open profession that pulls in so much of the new data that's coming in about everything, even our immune system's function and how that works with thought and neurology and stimulation and all that. So that's great. One of the big things that I've been around a fair amount of vets, sensitive to that issue. And my father was one. My father was injured, and it affected his whole life. So post-trauma, when you get someone that's in fresh out of a trauma, how do you start? Like, to me, that seems like I wouldn't know where to start personally on somebody that's coming in first visit. How do you start, like, post-traumatically with a patient when they first come in after trauma?
Yeah, that's great. So let me start first by defining trauma a little bit too. Just, to be on the same page kind of overall. So trauma, we use it a lot in lingo, right? In terms of, especially with veterans or people that have been through devastating things. Trauma is really any event that overwhelms your system and triggers an autonomic survival response in your
Good
body.
definition. I like that definition.
So it broadens it up because people think, well, I'm not a vet, so I haven't experienced trauma, so I can't blame my symptoms on trauma. But all the stats that you just mentioned also correlate with adverse childhood experiences of abuse, neglect, witnessing violence. Even stressful emotional things can overwhelm our system. Anytime our survival system wants to fight, flight, or freeze, that response has been triggered in some way, shape, or form. And so when folks come in for trauma, it's giving them the education around that. Hey, this isn't you, right? Because that's how people feel. They feel out of control, right, of their symptoms and the things and the suffering that they're going through. So the first thing is the education, a really good understanding of the survival system in the body and why it keeps tripping itself up. The trauma is stuck in there somewhere. Okay, so the first line of therapy is actually to really start doing things to soothe and ground the nervous system. We want to create safety for the person. And in mental health therapy, safety starts in the therapeutic relationship first and foremost, right? So as a therapist, I can't go too fast with someone. I can't go too slow with someone. I have to really be present and hear their story and see where they're at. At the same time, I also don't want to take someone and open up a trauma that they're not ready to open up or face yet. So the first step of trauma work in most treatment modalities that focus on trauma is safety and stabilization.
Okay.
And for a lot of these folks, especially veterans and post-combat, they come in and we ask, what helps you feel safe? And they've lost that concept. Everything is unsafe because that's what the military teaches you, hypervigilance. So we're recreating safety in as many ways as we can, visually, environmentally, and physically, teaching people how to take care of their bodies because there's safety, right, in their bodies that they can help create for themselves too.
Oh, that's great. No, I love your definition of trauma as well, like I said a second ago, because I think that's anything that we're going to work on, let's make sure we're working on the same thing. There's so many different ways of saying what's traumatic, and to call in that the autonomic nervous system is the one that's been woken up during this, I think is so important, because I'm always getting into the sympathetic and parasympathetic nervous systems, which I know you know about. Most people have no idea what that is, and I think that should be taught in first grade, because it is such an interesting idea that we can switch into these two different modes. People know, like, we're awake and we're asleep. Why don't we know that while we're awake, we have kind of a healing side and a performing side? And that, we need to pay attention to both of those. They're both important. You can't constantly be performing and never heal. And you can't constantly be in a healing state and never perform. People, because that's basically almost like a couch potato, if you think about it, right? If somebody really is just constantly resting, they're not stimulating their body, they're not performing, they're going to start losing some basic functions, mental and physical functions. So I think that's crucial. I have a question, another question. One of the most interesting things to me is how people heal. It's fascinating. It's a beautiful thing to be around when you foster the healing process and you feel like you're part of that. But then there's the aspect of people that won't heal. And I've always studied the failures as much as I've studied the successes. I love to bask in the successes in my practice, but I also want to be very astute of when someone doesn't heal, why. What do you think some of the main reasons people either don't or won't heal? What do you think that comes from?
You know, it's a subconscious process. So I knew we were going to talk about the brain at some point, and I'd like to map a few things out to try to explain what I mean by this. Okay, so I have a picture of the brain. Okay, so my brain isn't about artistry, as you can tell. It's about the science of it. Okay, but the biggest thing that I try to teach people, right, who are struggling, and we see people who have suffered for years and years, and that's what they've been labeled at, right? It's just, I keep running up against a wall. And so we break the brain up into three main areas. Okay. The outer area is our neocortex, and that's our thinking mind. Okay. And that's the part that evolved over time, right? That's our logic. That's our reasoning overall. The two systems that make up our subcortical or subconscious system, right, is our limbic system. This is where our emotions are, right? We don't control our emotions. That's an autonomic response. We hear, see something, an event, it triggers our emotions. And then this is the mammalian part of the brain, which basically means the basic survival. You know, why does when someone scare me, right, I like go to lift up a punch or try to defend myself? How is my body breathing without me thinking about it? How do I jerk awake at night, right, if something's obstructing my breathing? This is all my survival system. So when that gets triggered in traumas and the event gets stuck, they get undigested in our subcortical part in our brain. And when that's unhealthy, that starts actually influencing how we think about things. So we start self-defeating right off the bat. It's what you were saying earlier. This is where those underlying beliefs are. If I don't believe I'm good enough, that formulates my thoughts, which then formulate how I live. And so for a lot of folks that have trauma, they might not believe that they're worthy at the end of the day to get the treatment that they need, and therefore don't have necessarily the motivation to be able to get there.
Right.
The other thing that I want to point out while the brain is out is when we developed our thinking mind, okay, there was no function, even though they're in the same place in our body, that the subcortical system and the thinking mind communicate with one another, which means when I have a panic attack, right, my survival system, one of these stuck things got triggered. I have a panic attack and I think to myself, Lisa, calm down. There's nothing here, right, that you need to be worried about. That doesn't work because there is a disconnect between these two parts. Okay. What does work is the body. The body is the connector. The body has to relax its muscles. The body has to feel like it's not being hypervigilant or panicking at whatever the environment is around them. Then the subcortical system says, oh, the body's nice and relaxed, so I guess we can turn down our panic now. But that's what it is. People get stuck in thinking that they can think their way out of it, and then they get really frustrated.
Well, that's fascinating because when you work with patients, as I do, working their body, you see the correlation between their mind, and people tell me how much better they sleep the day they get adjusted. And I can see what you're saying, how that connection is between I'm creating a body stimulus and we're pulling them out of that stuck state within a part of the body you can't get through thought. You can get through body stimulation.
Exactly.
So tell me this real quickly then. So breathing obviously would be in that body category. So simply, instead of just saying, well, just calm down, right? Like the worst thing you can say, putting that person in a state where they're breathing better. would do a very similar thing. I would think it would cause that system to be fed from the body as well.
It would, as long as you're not having the thoughts. So a lot of people, excuse me, who come in who are having active anxiety and panic attacks, their mind starts racing, right? They start saying, this is awful, this is horrible. So while they're saying that, even if they are trying to breathe, it might not work.
Right.
If they can disconnect from thought and do the breathing, it might work best. I'm going to put in a cough drop.
Sure. One of the things I think that's fascinating is that how much you just take something like exercise and how that can be so sedative. And a lot of people think, well, I'm burning up my energy. And then you think, okay, where did that energy come from? A lot of that energy is coming from anxiety, or it's coming from thought. And the exercise isn't really solving the problem at a base level. It isn't solving it through really in any structured way, but it's at least burning off that energy put in that's racing around inside the mind. Because I always think that people have an idea, and that idea is maybe anxiety creating. And then the body's turning on the chemistry, which is lighting up the body, because the body says, okay, I want to solve this problem. And my lower brainstem, as you're saying, is saying, I solve problems with physical action, because that's the primal thing. I don't solve problems by talking and thinking, right? If you're down in that side of your brain. And so then the physical body says, okay, here I go. I'm going to go solve it physically. And whether that's, jumping up and down, going for a run, whatever it is, you're doing something that is expressing that energy physically. So at least it's coming out of there from the thought. But to be able to educate somebody that this is how it works is tremendous. And I like the way you put it. I think that's great. Some of the technologies you have, I think are really interesting. I was reading through the list of different therapeutic measures you have. Of the ones that you utilize, what do you think is one of the most misunderstood? Because in chiropractic, I think the whole profession is misunderstood. They understand a small portion of what we do, obviously back pain and headaches. But there's so much more that we do, and I think that we're misunderstood. I can't even imagine your technology is so much newer than the field of chiropractic. What's an example of something you do and you said, boy, that's just that people are completely misunderstanding this.
I think therapy still has that reputation, right? Of coming in and talking about how you feel about things. And the last 15, 20 years, we have really moved to treating the brain as an organ. And so therapy in and of itself isn't just sitting and talking anymore. People have stress balls. People are using art as an expression. There was a Grey's Anatomy episode on TV last year that talked about EMDR, which we'll get to. But it also showed a counselor throwing the stress balls at the wall when a client is angry. It's getting up, it's getting active. Like you were saying with exercise, the reason that works is because that's working with your fight system. Remember, our body, our survival system wants to fight back, wants to flight and get out of there, or it ends up freezing because those things didn't work. And so anytime we can reorient the system to play out what it needed to do, that helps unstick some of the things that got stuck in that subcortical system. So when I start talking about the body, people get very confused. Like, wait a minute, I'm here to talk about my relationship. Wait a minute, I'm here to talk about, just my depression in general. And I have to make that connection that all these things kind of interact with one another. And for a lot of folks, they also don't necessarily want to talk about past childhood adversities, right? I'm over that now. I'm in my adult life now. And that's what their thinking brain absolutely has moved on from that. But has their subcortical brain moved on from that? Wow. And do they see certain patterns of still feeling negative about the world or aspects of themselves that affect their work, their relationships, or different things like that? So I think people are surprised when it's like, oh, I don't just sit and talk for an hour. Like you're going to make me get up and do things. You're going to make me do some yoga poses. You're going to make me do some bilateral stimulation and some nervous system grounding. It's more active now, just therapy in general.
That's so fantastic, because that is something that's been going on in my field a little bit, but obviously not as well studied. But as I work with patients, I'm also talking to them, right? So some of my sessions turn into psychological counseling almost more than they do a chiropractic visit. And I certainly don't mind that. I wish I had more time to do that sometimes in the visits. But that is something that I've always appreciated, the connection between the physical and the emotional and the mental and the chemical, like I said earlier. But to be able to do all that, I one time, envisioned having a clinic where I'd actually feed people healthy food, talk to them, and then adjust them. I thought, what a great thing that would be, is to get them chemically, emotionally, and physically, and improve each one, right? I mean, a couple times I've had things at the front desk that people could sample, little shakes and stuff like that in the past. One time we had a Hawaiian day and we had all kinds of fruit at the front. People can scoop into little plastic cups just to mix it up and stuff. And I thought how cool it is to be able to feed people. As well, being Italian, you want to feed everybody, I think. And I thought, what an interesting way of approaching it. But yeah, I didn't even realize, and knowing you for a while, I didn't realize how much physical aspects there were in your counseling. That's great that you're getting people doing yoga, touching acupuncture points, touch for health points, maybe.
Yeah, we're going to talk about that. There's the emotional freedom technique. It's one of those short-term strategies. And no, I think that's great. That's one of the things that I've appreciated being a patient of yours. When I've referred people for chiropractor, I've said, sometimes my chiropractor is my own therapist. I feel like.
Yeah, absolutely. You and I've gotten into some pretty deep conversations on visits, and that's one of the reasons I grew to be so fond of you. As I said, what a sensitive, intelligent person this is. I really enjoy your company. And then when I started doing these podcasts, and you came, and I'm thinking, oh my God, I got to have her on, because and that was before I even realized I'm becoming more of a fan of yours as we go here, because I'm seeing so much commonality between your approach and mine now. I mean, it's fantastic. This next question I put together is just basically very similar to what we're already talking about. I heard this a long time ago, that the issues are in the tissues, an old saying. And the first time I heard it from a massage therapist, and she was talking about how physical abuse, being hit in a certain part of your body, let's say, and then if someone was to touch that part of your body therapeutically, it could set off the autonomic nervous system, and light up that kind of like, this isn't good thing. And an example I heard one time when I was reading one author was there was a man whose father used to pat him on the back sarcastically when he would strike out in baseball. He'd say, nice job, and you'd hit him on the back, like sarcastically. And of course, this young boy felt shame that he just struck out. Now his father's like sort of pointing it out. And people in the future would pat him on the back, saying, in truly meaning good job, when he did do a good job, but he felt shame because that part of his body was stimulated in a shameful pattern in his formative years, 0 to 7 years old. And he woke up to that and had to do some therapeutic things to get rid of it. So when you see the issues in the tissues, obviously you've touched on it already, but anything you want to add to that idea, that like, do you have areas that you actually have people change the sort of sensory stimuli in to try to break down things, whether it's sexual abuse or whether it's just plain, physical trauma that people have been through in a particular part of their body? Do you have a way of like unwinding that?
It's an interesting topic, because that's really what started the movement of therapy moving in this way. There were several key people in the 70s, 80s, and 90s that started saying trauma is held in the body. The body remembers trauma. So even pre-memories, right? Even when I'm in utero, while I'm developing, I don't have any actual, we call it explicit memory, right?
Okay.
So explicit memories are the memories that we can recall. And they are from about like age 3 or 4 up. But when you talk to folks who have been in difficult family situations or growing up, they don't have a lot of memory during that time. And that's because their memories are being held implicitly.
Wow.
And that means it's being held in our cells.
Yeah.
And so sometimes there is that direct, where that person's patted on the back. But other times it manifests and it goes other areas. So making that correlation to people, and actually, unfortunately, when there's cases of physical abuse and sexual abuse, the body's defensive system actually is to disconnect from the body.
Mm-hmm.
So therapy for those folks in safety and stabilization is to reconnect, excuse me, in a safe way.
Right.
So for some people, I just try to help them orient to a pinky finger or an earlobe, a place that I can theorize that was safe, hopefully.
Okay.
To start actually letting the brain reconnect to the body.
Mm-hmm.
So these are folks that have been traumatized maybe over a long period of time that, like I said, for safety reasons, just disconnected, totally. One of, in our therapy, we ask a lot, where do you feel that in your body? There's some folks that don't feel anything in their body. So we have to start there first. And Dr. Bessel van der Kolk is an MD out of Harvard, and his book, The Body Keeps the Score, is one of the ones that came out to really help understand that this is where it is. It's all in your body. And that's why therapies have moved into that direction of let's figure out muscle testing to find where trauma is. Let's do bilateral stimulation to soothe the nervous system. And it's with that understanding that it's our cells that remember it and that we can't think for ourselves. Our cells just do what they needed to do during that time again. And so we're not only triggered by maybe a physical aspect of it. So if I had a car accident on this street, what I might notice is even years later, if I were paying attention, that my muscles clench every time I drive in that spot, right? And I might not even notice it because it's just automatically happening. But not only can we be triggered that way, but we can be triggered in dynamics. So when emotionally we're reminded of a dynamic from long ago, of when someone disempowered us or someone we weren't able to protect ourselves in some way. Even if we're safe now, our body and our emotional mind sometimes will react like we're still back there.
Right. I can tell you, there's an intersection where I was slowing down one time and two cars collided and one of the cars flipped upside down, slid on its roof into the front of my car. Now my car was hit like 3 miles an hour, it cracked the grill. It was no big deal for me physically at all, but emotionally to see a car upside down, I jumped out of the car, cranked the door open and pulled the people out. And then I realized, oh my God, this is, I just went into this sort of like state of just get it done. And every time I pull up into that intersection, it isn't really trauma. It's kind of subtle. It's kind of like an adrenal awareness. And I start breathing a little deeper. it's not anything I need any real help with, but I just thought, I just observed that this intersection now for me, I can't let go of that memory. It's not really that negative, but it's just interesting that my body, the visual stimuli of this intersection makes me just go, all right, yeah, I take a little bit of a breath because I remember the event. Everybody was okay, thank God. But it was just really bizarre to see a car sliding on its roof towards your car. Certainly don't run into that every day. But yeah, how the body responds to this stuff and getting in that body and doing it, that is just, I think that's great. I mean, that's just the way to do it. Next,
and the difference between you in that scenario and others that might have a post-trauma response to that is maybe someone was pinned and they couldn't get out. So your body went into fight mode, right? It went into, let me jump in and action and see what I can do. But if my body wants to do that, but I'm closed in, right? Because of my seatbelt, because of the position of the car, then it gets stifled. Yeah.
Right, exactly. I got to be like a superhero. Everyone in the car didn't have that opportunity. I'm sure they would have done it. There's some very capable, young, smart people in that car, but they were upside down hanging by their seatbelts, so it was a whole different game for them, So yeah, for me, it was, it was a nice thing to be able to help these people. but it wasn't really traumatic as much as it was like exciting, but at the same time, quite an adrenal state there for a while, One of the things I work on is, obviously people in pain physically. And when you approach somebody, they're obviously coming in there with different disorders, emotional, mental health concerns. How many of them come in with a lot of physical body pain, and what do you do with that? How do you address an actual, like whether it's a migraine or back pain? Are there things that you say, this technique or this advice is going to be good, because we're obviously going to work on, the thought processes and like you drew out the brain, but what do you do about somebody that's actually in physical pain? Do you have sort of answers for that? Techniques that are more this way?
It's interesting because whether the cause is physical, like you were saying, structural or emotional, the pain is very real. So sometimes first acknowledging that is important, because especially in the typical healthcare world, right, our folks tend to get minimized, especially if it's a chronic condition. It's not just mental health, I think, that gets stigmatized. It's folks that, have to keep coming back in and things aren't getting better. And so sometimes just the validation of that and creating a space where the person can talk freely about their pain, where they don't feel like they're a burden to other people by still complaining about whatever pain that they're in. Mm-hmm. And then, sure, if it's something that might interfere with our work because their system is just on edge because it's pain right then and there, we have to sort of think of it like, how far are we going to get from an emotional standpoint if we don't address how to take care of what the person is experiencing? And in that way, we actually kind of model, right, how to take care of yourself. I've said to a lot of people, sometimes when I wake up in the morning, if my head kind of hurts or my stomach is off, what do? I just jump in the shower, press on for the day, right? And try to forget about it. But then it starts nagging me more and more and more. So it's actually okay to stop and say, let me tune in to this body part. And body parts talk, Dr. Mike, right? Ask the body part what it needs. And sometimes my stomach will say, oh, too much Mexican last night, right? Or my head might say, oh, you didn't sleep quite right. And once I acknowledge that, my body says, oh, okay, thanks for acknowledging that. Because then I say to myself, oh, I'm gonna go to bed early tonight. Or I say to myself, oh, I'm just gonna have some rice then for lunch, calm my stomach down. Then my body's sort of like, oh, okay, she's gonna take care of us. And it sort of can soothe and calm itself down. Okay. For other types of pain where it's structural, I have to try to assess for the person, how much is this feeding into their presenting issue, their depression, their anxiety? And in that regard too, are you taking care of yourself? Are you exploring nutrition? So I'm talking as much about good sleep hygiene and nutrition as I imagine you might be too. With folks, how do we get the basics going? Because at the very least, the pain can be minimized by the things that you are able to control versus what you might not be able to control right now.
I think the answer that I am so often when someone comes in and they, let's say it's their first visit and they can't figure out why can't I heal? Why can't I get better? What's with this? I'm always like, okay, let's start at the beginning. How much water are you drinking? How much protein do you ingest? How slowly do you eat? How much sleep are you getting? How much, the basics. And usually I can't get out of the two top basic things without somebody going, oh yeah, I'm not doing that. I'm not doing that. Right. It's really amazing. Rarely does someone come in and say, I'm doing all that right, and I'm still suffering in some way, shape, or form. Just once in a while, of course, but the first thing is let's get that out of the way. Let's master the fundamentals. Let's not discount the idea of the value of sleep. One time I was listening to a guy, basically one of these very successful people trying to help people that weren't doing so well. And he said, some of the things that made him successful in life, in all levels, was to not take today's frustrations into tomorrow. And the way he did that was to go to bed. He realized, okay, I'm fed up. I can't solve this issue. I'm exhausted. I'm frustrated. I'm going to bed, and I'm going to deal with this tomorrow. I can't do it right now. And he would go to bed early, get up early. And he had a new brain in a sense. He had not just more energy, all the right brain chemistry to be patient and more intuitive. but the rest and energy to do it. And then the issue that he was trying to solve became much easier to solve. So it wasn't like giving up, but it was putting on hold because he knew he had given us all that day, and it was time to refresh himself. But yeah, I think what you're saying is absolutely very important. But you mentioned earlier EMDR, and that's something that I've been fascinated with for years. It's something that it's really funny because since we scheduled this podcast, I had a patient on Monday say, I'm looking for somebody that does EMDR. I mean, so few people know what this actually is, right? And I laughed and I said, that's really funny. I know somebody that does it. And I gave him your information. And I said, where'd you even hear about it? And he was talking about the traumas that he's had in his life and people have suggested it to him. So give us a nice synopsis of what it is and how people can get to practitioners, if not you, anybody else, because this podcast hopefully is listened to all over the country. So tell me where they can go and what it is.
So EMDR stands for eye movement reprocessing and desensitization.
Okay.
And I'm going to explain that because that's a mouthful, right? Mm-hmm. So in the 80s, the developer Francine Shapiro noticed that when she was moving her eyes back and forth, right, just not really doing it on purpose, but just as she was doing it while thinking of something traumatic and distressing, that she started feeling better. Her thoughts just started kind of going through and saying and started soothing her and trying to give her what she needed, to hear. And her body started relaxing. Like you said, those systems started going back down for her. Mm-hmm. And so she decided to study it. And excuse me, what they found now and have researched support around it, it's an evidence-based treatment in that way, is that yes, when we bilaterally stimulate our brain, we open a connection between that neocortex, the thinking brain, and the subcortical system to get them working together, to unstick some of the things that are stuck in the subcortical system.
Right.
And we have to do it in a very desensitizing way. And when you desensitize for something, you do it very systematically and you start small, right? So let's say you were phobic of a spider, right? So the first time was, I might put a spider in the same room with you, but maybe way across the other side of the room. Mm-hmm. Okay. Mm-hmm. And then I'd inch it closer the next time and closer the next time, that sort of thing. So that's what we're doing in EMDR. We're desensitizing the trauma with bilateral stimulation. The bilateral stimulation is what keeps the person present and grounded. It keeps the body saying, oh, we can go back now into this trauma memory. Okay. And our body's now relaxed now while we're going back into the trauma memory. And so now we're going to let it process through. Now, instead of it being stuck in our survival system, now we have the resources to be able to process it through. So at the beginning of the EMDR memory, there's usually a negative thought attached to it. I'm not safe. I'm not good enough. I'm bad. I'm defective. And by the end, you start saying things like, I am okay the way that I am. The world is safe. I can trust myself in the world. So that's how we know it's become unstuck, because that belief starts feeling true overall. And when it first came out, people were like, yeah, right. I'm going to move my eyes back and forth, right, and feel better. But that's why the research was so important. Over and over and over again, it just supported that people were reducing their symptoms. People were reducing their physical health symptoms with it. They were starting to feel better. They were being less triggered overall. So what happened is there's a United States sort of organization for EMDR. It's called EMDRIA, EMDRIA.org. And all certified EMDR therapists are listed by location on this website.
Okay.
So I don't know if you share information when you put the podcast up, but maybe we can put the website. Yeah. And then
Absolutely.
you can type in, I live in Colorado, and they will
Right.
show you who the certified EMDR therapists are around them. And there's a lot of good information on that website about what EMDR is also.
That's really great. And one of the things that lit up in my mind as you were talking about this was the correlation that I've seen and things I've done with brain balancing, giving people hand exercises. I've given people eye exercises to strengthen eyes and to round off the eye for better visual acuity. But I've never used the eyes in any therapeutic way to that degree at all. But I've used the body that way. And when you stimulate the body bilaterally and you almost confuse the body as to left and right, it starts waking up the corpus callosum, that connective tissue I'm sure you're aware of between the two hemispheres of the brain. And you start being able to use both sides of the brain to solve an issue or to relax the body, because you don't want to get stuck on the left or right hemisphere. I mean, there's so many theories about savant-like behavior or brain dominance behavior, and how that relates to personality disorders, personality issues overall. And I love giving people a couple of simple hand movements, and I've done it in other podcasts, that unstick the brain as far as a dominance. Also music that's been shown now to stimulate one side of the brain or the other. But whatever the case is, let's get out of our pattern, because a lot of things that we are doing that are dysfunctional are just a simple pattern that we got stuck into. A good friend of mine I've had on the podcast before, Dr. Fred Clary, would get into this concept of old tapes. In other words, he had these old tapes from his childhood of things that were told to him that maybe were somewhat true at the time, maybe they weren't, but they certainly aren't anymore. They could have been something from the past, but it's time to say, no, now I'm an adult, now I'm responsible, and I'm going to move on. And all that stuff that was told to me, it was probably wrong in the beginning, especially if it was abusive stuff, it was wrong. But right now, I can tell you that I'm such a different person, so that doesn't count anymore. And that was another way to get out of that sort of pattern.
Yeah.
But yeah, you think about how important the eyes are and how much stimulation. I think it's like 80% of our input comes in through the eyes in our daily experiences. So why not use the eyes, since they're so hooked up from a stimulus and neural standpoint, to change or to alter or to stimulate parts of the body? Just thinking back, and it's amazing somebody didn't come up with this earlier, that we know about stimulating the body, but why not use one of the major sense organs of the body to do something?
It's the majorest sense tied to our survival, right?
Sure.
Because we can get away with maybe not hearing, but not seeing, right, really is a testament to our survival. And that's why, the neural connection is so tied into the eyes. The other good news is, ever since the pandemic started, right, a lot of us therapists were trying to figure out, how do we do EMDR when we're not in person with people? And so we started doing what's called the butterfly tap. And so we can have folks do their own bilateral stimulation simply by tapping right underneath their shoulder blades back and forth. And that this is replacing, it's not, the research is for the eye movements, but a lot of the research for butterfly tapping is showing very well that it produces the same effects. And I have clients that will tap their legs, because some people can't move their eyes very comfortably back and forth. So there's other options, there's other tools. We do have headphones that will provide stimulus back and forth. We have these hand buzzers that we use too. That the person, it buzzes each hand back and forth. And, we got a really great plug recently when Prince Harry and Oprah's show on Apple TV talking about trauma showed Prince Harry himself getting EMDR in the third episode.
Oh, wow.
And he was butterfly tapping for it.
Okay.
Yeah.
Great. Yeah, exposure like that's so important. So many people pay attention to our stars or influencers, that when someone of that fame says something, people tend to hear it more, and it's watched by so many millions of people. That's fantastic.
Right. And so it's getting out there more and more. Yeah.
Yeah, that's exciting. Getting into that, how much biofeedback do you use? Is that something that is something that I remember learning about, probably in the mid 80s, the concept of biological feedback tools. Do you use anything like that, or is that more something from the past?
I don't, but some therapists have. Some therapists will have a pulsometer to monitor pulse rates during processing of trauma, blood pressure cuffs. There are some therapists that have studied that. In fact, some of the newer trauma therapies like brain spotting, somatic experiencing, they're actually hooking up live MRIs to folks' brain to see what's happening, because we're trying to figure out, right, how exactly is this helping heal out the brain? And there's still so much about the brain that we don't know. So that's like the ultimate feedback, right? Because then in the moment you can see, oh, maybe I should go back and do this again. So biofeedback is great because it can individuate these kinds of trauma therapies to that person and what they're experiencing in the moment. Neurofeedback is gaining popularity, and there's a couple places in most cities now that will do some neurofeedback, and that's resetting some of the neuro pathways to go back to when you were young, before maybe you had these experiences that altered them. So there, lots of different things are coming out with understanding this process now.
Yeah, it's still in the mix in a sense, and being
it is.
used as we go. That's good. You mentioned a few names earlier of people that maybe influenced you. Who would you say is one or more that have really shaped your counseling style? Somebody, maybe some of our listeners might want to read a book by someone who sort of got you started. Something, maybe bridging the layman and the professional type of data. Who would you mention that fits in that category?
That's interesting. The first person I think of is the developer of another therapy called DBT, dialectical behavior therapy. And this was also developed in the 80s, but it took off a lot faster than EMDR did because it was a talk-based therapy. What was different about it, though, was therapy for years beforehand, after we got rid of some of the Freud stuff, went to cognitive behavior therapy, which is kind of what we were talking about. We look at a thought, is it rational? Change the thought, change the feeling, change the behavior. But for many folks, this wasn't working. And now we know those folks mostly had experienced quite a bit of trauma. And there's no use in trying to convince someone, right, when they're in that mode, that no, the world isn't against you. No, you aren't a burden to people, right? They're very fixated on that. So Marsha Linehan came along, and she's the one that introduced mindfulness into psychology and said, you know what, let's validate, let's ground the person, and not validate their irrational thought, but validate what it's bringing up for them. Okay. And then let's offer them choices for how to soothe, for how to cope, for how to emotionally regulate what's going on. So it's very destigmatizing to me as a young therapist to, not blame people for cutting behaviors or feeling suicidal all of the time, to really just sit with someone and say, tell me what's going on beyond that. Versus panicking, right? Oh my gosh, if they're suicidal, I might have to send them to the hospital. I might have to do this. Just saying, well, what's going on? Tell me more. And so her approach is it's sort of nonchalant and a little irreverent, actually, but she's very direct and she's very comforting. And what she does is she retools people. She says, your emotions are up here. And maybe these are the skills for self-soothing that you didn't learn because of the environment you grew up with. These are the skills for emotionally regulating yourself. And she empowers people by teaching life skills over again. And in that process as a therapist, and this is what I was going to mention before, if for those that might be thinking, oh my gosh, every time my survival system, gets overwhelmed, I might be traumatized, right? Well, the good news is the body is very healing and the body wants to heal. And one of the biggest ways to heal is through connection. Okay. And one of the biggest ways you can do that is by sitting with someone, right? Just companioning them, but also helping retool. And saying, you know what, I'm going to teach you how to get through when your relationships go awry. I'm going to teach you how to get through when you can't control your emotions at work and get into trouble a lot. So it's a very non-threatening, non-judgmental approach. And that fit my style. You know, I appreciate you saying, you know, I have some sensitivity to this. And that's where my mind went, is why is this person acting that way? Not, you know, well, how do we fix this problem? You know? So I like her approach to it. She's very active on the West Coast. And
Does she have one book that you would recommend?
She doesn't have a book, but there's a lot of DBT resources online.
Okay.
And like I said, they're distress tolerance skills, mindfulness skills, emotion regulation skills, and interpersonal effectiveness skills.
Fantastic.
Yeah, and there's a lot of great support online, a lot of great YouTube videos on DBT when you look it up.
Okay, fantastic. All right, so before we go, lastly, I always like to leave our listeners with some basic tools and ideas. So for me, what do you think 3 steps, 3 things people can do to just improve their happiness, their joy, their mental health? Give us like 3 tips. What do you think are missing?
One I'll steal from you, which is breath training. So breath training is when you purposefully not wait for an anxious moment to practice your breathing, but just like brushing your teeth, actually take what you do is a real quick one is a square breathing. So you just draw a square, right? And then you count 1, 2, 3 as you breathe in, hold 1, 2, 3 as you cross over, breathe out 1, 2, 3, and then hold 1, 2, 3. And what happens is you strengthen your diaphragm over time by practicing it, just like you would working out a muscle, right? You strengthen it so that when you're not thinking about breathing, your muscle is taking nice deep breaths. That's keeping your oxygen flowing. That's keeping your mind clearer. It's keeping you more regulated overall. So that's the first one. The second one, I'm going to steal from Dr. Bessel van der Kolk that I mentioned before. So here he is, this Harvard professor, right? He's done studies since the 80s that put yoga against antidepressants. And yoga wins every time.
Fantastic.
And, you know, no one publishes this stuff because yoga isn't a pill, unfortunately.
So hard to listen to it.
You know, over time, I mean, this isn't a substitute for antidepressants, right? I'm not saying that. But what I am saying is yoga is a great place to start. Even if it's a couple poses, we can see changes in MRI scans from mindfulness and yoga. It just de-stresses that system, the parasympathetic and sympathetic nervous system. It helps heal any stress that your brain is going through. So that's another one. And emotional freedom technique that I mentioned before. And that's a series of, they call it tapping too, where you tap on different points, okay, with the intention of either I have a headache today, or I'm feeling sad about this situation. You can target pain, you can target emotions, you can target anxiety in general, depression in general. And what it does is it just helps reset the system. And
now you say an affirmation. You say an affirmation with that, if I'm not mistaken. I learned it this way. You might be.
You do a setup statement, okay? So if I'm going to work on, oh, you know what? I have a pain or tension in my shoulders. So you do a karate chop motion, and you say out loud, even though I have this pain, tension, whatever it might be, I still love and accept myself. Even if you don't believe it, you have to say it out loud 3 times. Okay. And then the fun part is you go through these different points. Okay, there's one on here, one on here. And with each point, you actually kind of get to complain about it, right? Like, this is so annoying. I'm really suffering with this. There's a point here. And we can add another website for this too. There's a point under your arm. And you just say, man, I just can't take this. And I do the top of my head. I take a nice deep breath. And I do that sequence a couple of times. Okay. And what happens is let's say I started at a 6 from like a 0 to 10 scale. It was really bothering me like a 6. After I do it a couple of times, it might be a 4. Does it get rid of it? No. But does it take the edge off of it? You know, am I able to focus on other things? Did my body feel acknowledged, right? That's you know, my pain. And so it lets go of some of the tension associated with it.
Right. Right. Well, that's fantastic. I love EFT. I read that a little bit ago, and it's something that by you bringing it up makes me want to, reutilize it. I've done it in practice on patients. It's so fast. I just do it in the room on people historically. I haven't done it in a while, so I'm glad you're bringing that back up and got me thinking about that again. So breath work, yoga, EFT, your three favorite,
go-tos.
Quick, simple. Yeah, and what you mentioned about the research on yoga versus antidepressants is probably one of the biggest reasons I do these podcasts, and I'm passionate about the type of work I do, is my irritation with the amount of money and time it put into researching to put out more drugs to give people, and the lack of respect and time put into natural cures. And I understand, that's a big industry. It makes a lot of money, and it has massive influence over our news and over our programming and even over our movies, in my opinion. It's a massive brainwash going on. But I think that, and there are times where, like you mentioned earlier, you don't just go off an antidepressant because you're doing yoga today. It is something that you do very cautiously, and you do it with a healthcare professional, obviously. But the idea that these things work so well, and they should be incorporated, and they should be promoted by every healthcare professional. And everybody should, if you're treating patients, you should have in your tool belt natural and unnatural help, and no matter who you are. I don't care if you're a psychiatrist or a psychologist or any type of counselor, you should be able to speak as well about yoga as you can, naming the 10 best antidepressants out there and all the side effects. That's nice that you know that, but at least this patient is suffering, and your job is to help them. The patient first. That's the idea. It isn't, my paradigm and my belief system is the pharmaceutical approach. That might be what you're great at, but at least show some respect for ancient wisdoms and things that we've proven over time-tested ideas that help the body, like you say, and like obviously, how much water are you drinking? How much are you moving? Master the fundamentals. I know that from martial arts training. If you don't have a good front kick, your side kick's not going to be very good. And then everything from that foundational movement isn't going to be as great because you haven't mastered the fundamentals. And in my mind, the fundamentals are breathing, motion, water, and then of course getting your thoughts in order and getting your mind right, which is obviously one of your expertise. So, well, Lisa, thanks for coming on the show today. It was fantastic. I think our viewers are going to love what you had to say. Hopefully they're on fire to just look up the books and the ideas and get online and do the YouTube videos for some of the stuff you mentioned today. I think it's so important that we pay attention to mental health. We get the stigma of that it's something embarrassing, when all of us are dealing with, to one degree or another, some form of mental health imperfections. No one's walking around the sanest, calmest, most wonderful spiritual person in the world just floating around. We all have our challenges. Some people have more than others, but to call someone, this person has this disease, sometimes that's a little bit limiting. We really should just say, okay, this needs help, and let's just all love and focus on these people and ourselves, so we can all be living in a happier world. So
the brain is an organ, just like a heart, right?
Right.
And the heart gets high blood pressure. The heart, has its issues. And so this is how the brain manifests the issues. And it just wants the healing process to happen, which can happen.
Fantastic. Yeah. Fantastic. Great way to say it. Thanks again, Lisa. We'll have a great day. We'll talk soon.
Thank you.
You're welcome. That should be enough lead time for Mitch.
Oh, okay.
So that was give him a little bit of time so you can chop it. Well, that was great, Lisa. Thank you. I think that went well.
Sorry, I was coughing. I get that tickle in my throat when the allergies are spewing around. Yeah.
I think the grasses are open right now. I think the grass.
And I got the windows open because finally, it was like a break to get some air.
Yeah. I think I have a list of all the stuff that comes up and comes down. The allergens, so I know which ones. I'm rough with grasses too. About a week ago, I had a lot of the postnasal drip. I was having trouble sleeping because I just kept gargling around. It was just disgusting. Yeah. So sometimes I'll drink some vinegar or stuff like that, and it'll help break down the mucus. Vinegar is a great thing at thinning mucus, by the way.
Okay.
You can tolerate it. I mean, what I'll do is I'll dilute
apple cider one.
Yeah, I'll
Apple
dilute
cider
it down
vinegar.
with water and a little bit
Uh-huh.
of lemon, and then I'll drink it with a straw to the back of my throat to help break the mucus down.
Okay.
So that's pretty cool. Yeah, for some reason Mitch is still recording us. But anyway, all right, you can hang up. Thank you for
Okay,
everything.
great.
And we will talk soon. All right.
Sounds good. Thanks.
Take care. Bye.